Fatigue and tiredness, could it be related to your scoliosis? Over my 26 years of practice, one common complaint I get from scoliosis patients is that they feel tired or they have fatigue, and they feel more of this than their counterparts. And as far as I know, there's not a lot of official empirical data or research regarding how scoliosis can affect somebody's energy levels or could make them tired, but I've noticed it clinically in my 26 years. And so in understanding how this can happen, we first have to understand is what does scoliosis involve? Well, we know scoliosis involves an abnormal curvature of the spine from the front view, meaning it creates a curve of 10 degrees or greater with rotation from the front view. These 10-degree curves, or these curves of greater than 10 degrees, are typically associated with also a loss of normal curvatures from the side. And when we lose these normal curvatures from the side, the body has to deal with consequences with this asymmetrical spine loss in both directions, from the front and the side. One thing we have to understand is, why does the spine have curves from the side, and why is it not just straight from the side like it is from the front? When we have curves, or natural curves in the spine, meaning in the neck, in the mid-back, and the low back, and this is called lordosis in the neck and low back, and a kyphosis in the thoracic spine, this makes the spine stronger to gravitational forces, meaning as the spine is being pressed down on a daily basis, these curves act like a spring system, a shock-absorbing system, and they absorb the forces very well, and that's why our spines are designed to have these normal curvatures. It makes the spine more flexible, it makes it more mechanically sound to deal with our daily stressors. When we have scoliosis, we know that this can be impacted from the side, but it also comes with the curvature from the front, which leads to some posture changes that we tend to see in very common signs of scoliosis. We see uneven shoulders, uneven hips, and things like that. In adults, we can tend to see pain, and this pain tends to be in the low back, tends to be dull, achy, sometimes can radiate down into the legs, and tends to be exacerbated in the evening. They feel worse as they go throughout their day, showing you that their spine is not efficient at stabilizing forces of gravity over time, because they feel worse in the evening, going to bed in pain. They wake up in the morning feeling better. So is this energy level, can it be associated, or fatigue can be associated, or a common symptom of scoliosis? Absolutely, because like I said, if the spine's out of this normal alignment, it's inefficient. It's inefficient to these gravitational forces in both directions, in the side view and in the front view. So therefore, gravity is not kind to asymmetry. And this asymmetry causes your muscles of your body to contract more than they need to help deal with your balance and keeping you upright. So therefore, this can create fatigue and tiredness where other patients or other people wouldn't have that, because their bodies are not working as hard. Also, it creates fatigue because you're always stabilizing yourself more than somebody else, meaning patients with scoliosis are known to also have balance issues. They're not as coordinated, and so therefore they're more prone to injury in a way. So therefore they always feel like they're always kind of checking their balances and looking around, because that's one common characteristics I tend to see with scoliosis patients, is that they're kind of clumsy in a way. Not all, but some are. So therefore it can create the body's always reacting, and you're always cautious because you feel like you have this loss of balance. So the main factors that determine in terms of how much fatigue you can have, number one is going to be severity. The bigger the curve, the more your body is working to deal with the gravitational asymmetry that's happening and the asymmetrical muscle contractions that are happening, and how your body is dealing with gravity. So size of curve, meaning if you have a mild curve, less than 25 degrees, it's going to have much less impact, versus if you have a large curve, like 40, 45, or 50 degrees, 60, 70, 80, you're going to have a much greater impact on how much your body's working. In addition, as these curves get bigger, they also can affect other functions of the body, meaning bigger curves can now start affecting cardiovascular function, lung function. It can start affecting digestive function, which can also lead to, meaning that your body's working harder in these areas, which can also lead to your fatigue level. So bigger curve, more fatigue problems that we tend to see. Condition, meaning that some scoliosis cases are not just idiopathic, meaning they have more problems than just scoliosis, like a neuromuscular condition. Neuromuscular conditions that affect the tissues of the body can lead to fatigue levels. So therefore, scoliosis can be associated with that type. And of course, patient age. And I always kind of said that, as you got older, more likely you have more fatigue levels. But what I noticed is there's a gap. What I noticed clinically is that kids tend to have it, But between 20 and 40, people tend to do okay. It seems like their body adapts and gets used to what's going on, and they learn to cope with it. But when we start breaking 40, 45 years of age, I noticed a complaint kind of coming back to patients saying, I just kind of feel tired at the end of the day. I don't have the energy levels I used to have. And they tend to see this energy gap that tends to happen. So there tends to be a little gap there between 20 and 40. But basically, as you get older, more likely you're going to have this issue with that 20 to 40 year gap. In addition, it can create fatigue because scoliosis very often can affect the way you sleep. Now, the reason why it can affect the way you sleep is, number one, is with adults, it definitely causes pain. And when it creates pain, obviously that can affect the way you sleep, because the most common time scoliosis patients feel pain in the adult stage is when they go to bed after a long day of work, a long day of activity. The compression tends to sit down because the inefficient use of gravitational forces of the spine. It leads to low back pain, most common, and they go to bed in pain and they don't sleep well. Secondarily is because scoliosis creates postural changes. Most patients have a hard time finding comfortable positions to sleep because they have asymmetrical rib formation, they have asymmetrical pelvis, asymmetrical shoulders, and therefore there's no real good comfortable position they can get in, because they all find some discomfort in the positions that they lay because they have pressure points that most patients don't have. That can be also a problem that affects sleep. And then lastly, like I mentioned before, as curves get bigger, they can start affecting other functions like neurological functions, lung functions, cardiovascular functions, which we know can affect sleep as well. Every case is absolutely unique when it comes to scoliosis. Every curve presentation is absolutely unique, and every single person will respond differently to the scoliosis in terms of what it causes and what it doesn't. However, we know one thing, that if you're having problems that are associated with your scoliosis, like fatigue and other conditions possibly, the best approach is not to treat the symptom, but to address the cause. And to address the cause means that you have to reduce the scoliosis, manage the curve progression, and manage that curve for your entire life, so therefore it doesn't continue to progress and cause more problems that can create more fatigue and other health conditions. So at Scoliosis Reduction Center, we recommend early treatment, because we know early treatment means better results and it means better long-term outcomes. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.